Hello, in this video we are going to review information about case reports and case series from Chapter 7 of your textbook. In this video we are going to discuss the objectives of case series and case reports. We're going to outline the necessary components of a case report, describe the design and methodology of case series studies, and evaluate strengths and weaknesses of both of these types. We'll also critically evaluate results reported in case reports and case series. Case report and case series are a type of descriptive study. In a case report, it's a detailed discussion of a medical scenario in light of the currently available literature and an evaluation of the findings. Whereas a case series is a description of a group of patients with a common aspect like a diagnosis or treatment that is evaluated over a period of time. Like I said, a case report is a brief report of a clinical characteristics or course, but it's from a single clinical subject or event without a comparison. It describes a situation, and most importantly, it cannot answer a hypothesis. There are a variety of different types of case reports, and these are listed here in the table. You have disease identification, so previously unknown or variant of known condition. However, in these types of case reports, the reader must avoid generalization of the rare condition. Probably the most common is the adverse drug reaction reporting, or ADR. This is the most common source of information for drug removal. Excellent in identifying rare and serious ADRs. Utility in identifying ADRs in special populations. Case reports can cover a new treatment approach, so generally used to generate a hypothesis for further testing with a more resource-intensive design. May lead to unsubstantiated use of medications for unapproved indications, which is one downside and something to be careful of. It can be in educational materials, so it can present a scenario to help clinicians improve practice skills. And it can also be used to highlight quality assurance, so giving information about practice errors that can illustrate problems to avoid by other practitioners. Case report designs can be retrospective or prospective. Retrospective is the more common version, and these, if you remember, are cases where the information has already been collected, so you are looking back on the observations after an event has happened. In a prospective design, it takes a little bit more planning, but because you need to pre-plan a treatment, you need to manage the patients according to the plan and record information. In a case report, there's a couple important steps that need to be taken. So first, you need to recognize a novel situation, review the literature to make sure it's unique, communicate with other healthcare providers to avoid duplicate work, select the right journal for submission, obtain consent from the patient or next of kin if the person has passed away, and collect the relevant patient information. In writing up a case report, it's important there's a clear title, a structured abstract, that you have a strong introduction on an issue that goes in sufficient depth to highlight the relevance and importance of the case, a description of the patient case, such as that's adequate to allow the reader to fully evaluate the situation. You want to remove any identifying information about the patient. You want to provide a complete medication history, clear time course of events, and you want to avoid extraneous information in this section. And in your description of the patient case, you're not going to be including conclusions at this point. In the discussion, this is where you are going to evaluate the situation or the case in light of the literature. You're going to state what's unique and to be learned, evaluate the validity of the relationship, including an evaluation of other causes, provide a summary of important aspects, and give some ideas for directions for future work. Finally, in your conclusion, you're going to go over what can be gleaned from the case. You are not going to, in any circumstance, draw any conclusions that cannot be supported by the facts. All of these features are characteristics of a good case report. So in evaluating cases, there are tools available that can help to analyze the strength of the relationship being described. These are two examples that are described in more detail in the textbook. These tools provide objectivity in the evaluation of the case's facts and can be used by readers, authors, reviewers, and editors to evaluate the validity of the relationship between a medication and an adverse event. the Guideline for Good Clinical Practice has differentiated between an ADR, an adverse drug reaction, and an adverse event. Adverse drug reaction is, it's according to the ICH, it should have a causal relationship or at least a reasonable possibility of a relationship between a medication and an adverse event. Whereas an adverse event is any untoward medical occurrence that's not necessarily associated with a medication. When critically evaluating case reports, the overall report, there's a nice tool that was created called Pearson's tool. It's based on scoring the case report on 5 criteria. So first, documentation, evidence supporting the content, uniqueness, it requires complete literature search, the educational value, so possibilities to actually apply this into practice, objectivity, so the level of bias, and interpretation, support for the conclusions. So there are some obvious strengths and weaknesses of case reports. Strengths being identifying rare occurrences, identifying delayed adverse drug reactions. They are hypothesis generating. They really require minimal resources to conduct. But there are also very important weaknesses. So this is one of the weaker study designs because no causal inference can be made. There's huge potential for reporting bias because usually only those with maybe no low adverse events or only positive outcomes get reported. No statistical analyses can be done on a single person, and there's potential for reporting false results. Case series is defined as a group of patients who have been diagnosed with the same condition or are following similar procedures over a period of time. In case series, it's important to understand there's no comparison group, so this makes it primarily a descriptive study. You can evaluate a disease course, adverse drug reactions, or effectiveness, and it paves the way for stronger, more robust methodologies. So again, it's one of the weaker observational type designs. Some key features of a case report series are listed here in this table that's taken from your textbook. So there's a research question that's clearly defined, does not involve comparative efficacy, so there's no comparison group. The study population is well defined with inclusion-exclusion criteria. They describe patients that are not included or lost to follow-up. There's description of the practice setting, which is really important to know, to be able to generalize the findings of a case series to not only your own patients, but also the setting in which you're practicing. There's a thorough description of the primary intervention and a complete presentation of all co-interventions. The information on validity and reliability of measures, for the outcome measures, description of what constitutes improvement, outline of time frame for follow-up, blinding of those collecting outcome measures from knowledge of the specific intervention, source and method of data collection. Like I said, there really aren't many statistical analyses that can be done, mainly descriptive. However, there are some ways in which if the individual patient serves as its own kind of control in a pre versus post intervention, you can take measures pre and post, and that's the only reason you would do any sort of comparative statistical analysis. You could also compare to historical data, and if you remember, we talked about that in the other observational design video. For the discussion and conclusion, statements are consistent with the nature of this data reported, and there's acknowledgement of funding source or other potential conflicts of interest. Some strengths of case series are that the study results are closer to those of routine clinical practice because you have more than just one subject that you're talking about. It may be useful when a randomized controlled trial is challenging to conduct. There's high external validity because of the larger group sizes. It's cost-effective and time-saving design. But again, there's important weaknesses. No causal inference can be made. It's susceptible to selection and measurement bias. Absolute risk cannot be calculated because there's a lack of a comparison group. So conversely, in a cohort study, since patients are selected based on their exposure to a risk factor such as smoking or an intervention such as hip replacement, you can calculate relative risk for a given outcome, because given a particular exposure, an absolute risk or rate for an outcome can be calculated, and this includes the relative risk. And then lastly, a weakness is that data collection may be incomplete. So in conclusion, some main features of case reports and case series, and the first one here is really important, is that causal inferences cannot be made. These types of reports and series are effective in recognizing novel occurrence and generating new hypotheses about the medication's safety and efficacy. Typically, the first form of evidence in clinical medicine, and I've bolded this here because that's one of the main strengths of these reports. It's easy to implement and cost effective. Limitations exist due to the observational design, lack of a control group, confounding factors, and potential biases. And more evidence must be obtained before drawing conclusions in nearly all situations. And I really like this last bullet point. So although these are the weakest in the hierarchy of evidence, they are the strongest in generating new ideas for future research.